Can we pretend that airplanes in the night sky?
Good evening, Dr. Chu. My name is Edward and I'm from Taylor's College. I'm a physics student and I'm conducting this interview for my physics ISU. Could I get your name and career, please?
Yeah, I'm Dr. Chu Su Ching. I'm an orthodontist practicing in a private clinic in Klang.
Thank you. So I'm going to be asking you a series of questions and you can answer the questions however way you like. Question number one, what made you want to become a dentist?
I attended a career week, a talk actually, on different types of career after my A-levels. And it was this talk about dentistry that really got my attention. I was doing science at the time and my brother was already doing medicine, so I didn't want to go into the same line. So the next best choice I thought was dentistry.
Yes. What was the road like becoming a dentist? Did you face ups and downs?
It was quite a difficult course. We were in UM at the time.
Okay.
At that moment, it was just UM that offered dentistry. But now I believe there are about at least 17 private colleges and universities in Malaysia that offers dentistry. So first of all, it was difficult to get in. And once you get in, it's a lot of hard work because we have a series of lectures in the morning and then we have to see our patients in the afternoon. And after that, we have to go to the lab and do all the lab work ourselves. So it was really hard work. But yeah.
What objects do you require to become a dentist? What subjects, sorry?
We needed biology, chemistry, and physics, and maths.
In what way do you use physics in your everyday practices?
Yeah, that's true. Actually, it's not really being used. Yeah. But at the time, we didn't have much choice. You either do a double maths or you have to do physics. So if you do double maths without the physics, then you can't go into dentistry.
Okay, so physics is you don't really practice it in every.
Yeah.
Okay, so more importantly is for biology and chemistry.
Yeah, I would think so.
Other than academic wise, are there any skills that you think is required to become a dentist?
Yeah, I think you have to be quite good with your hands to enjoy dentistry.
Okay.
Yeah, because say for example, if you're doing a filling, you can do it much nicer and easier if you're good with your handwork. And you should be gentle as well,
Okay.
so that the patient doesn't experience much pain.
Okay. Thank you. How physically demanding is your job?
A lot of dentists actually have backache as one of the problems later on in life. And it's very time consuming. Every patient, I would say, would take up at least half an hour of the time.
Okay.
Whereas if you're a doctor, you might only need like 5 minutes or 10 minutes to see a patient. So we can see maybe, I don't know, 20 to 30 patients a day, and that's about it.
Was it always like this, or in the beginning was it fine?
What do you mean?
Was it always this physically demanding?
As you get older, I suppose it's more difficult for our back, and eyesight is a problem as well as you get above 40 years old.
What are the particular highlights of your career? Examples would be situations that you're incredibly proud of.
When I fix people's teeth with braces, you can see how the person transforms. A child with very crooked teeth and so shy to go out if they have a huge overjet. When at the end of the treatment, they are transformed and they feel confident and they are so happy. Some really thank you, and you can see the changes themselves. It is quite rewarding in itself. Yeah.
Cases like me.
That's good.
Do Do you recommend me to become a dentist?
Yeah, if you like this kind of job. When I first started out with dentistry, a lot of my friends tease me, "Oh, do you like looking into people's mouths whole day long? Sometimes there's a bad smell, or you see all the black stains and food in their mouth. It's not always pleasant, but the reward is when you can stop somebody from having pain and you can change their look, even by doing a denture or fixing their gums. There are many fields in dentistry. Actually, you want to help the patient. You have the periodontitis, which is gum disease. You can help to strengthen their teeth back again, or prevent them from loosening their teeth. And then you have the restorative field, where you can build up lost teeth by issuing them dentures or bridges, or giving them implants. And then you can, of course, stop their pain by probably plucking out the bad tooth or doing root canal treatments for them. So in many ways, you can help patients.
You're an orthodontist, right?
Yeah.
How is that different from a regular dentist?
Orthodontist, actually, the treatment for the patient is very long. Usually, it takes about 2 years to complete a treatment. So, in a way, it's nicer that we don't see blood and we don't see pain. It's quite happy patients, children who come in quite happy and they go out quite happy. That's quite nice. But the drawback, I would say, is the long-term commitment. Once you take in a patient, you have to see them through until the treatment is complete. So it's hard for us to go for long holidays. Say in future, if I want to see my children, if they're staying overseas, if I just want to take 6 months off, it will probably not be possible for me.
Of course, you have patience.
Yeah, that's right.
How does the market look like now? How will it look like in 10 years? Will there be a job available to me should I decide to pursue dentistry?
I think it's already getting quite saturated, to be honest. With the number of dentists coming out every year, I believe there are about 1,000 or more than 1,000 dentists that's coming out from the local institutions as well as from overseas. So, in fact, what I heard is in the government clinics, a lot of dentists are not treating patients half of the time. They have to take turns because even the number of dental chairs available is limited. Like supposing you have only 8 chairs, but there are like 16 dentists working there. So they will take turns, like alternate days they work. Even in any new housing area, you will see one of the new shops to come up will be a dental clinic. So I don't dare to take it in a few years' time. I don't know. We'll see.
What is your most favorite part about being a dentist?
Favorite part? Treating patients, hopefully they are satisfied with the treatment, and seeing them going home happy and relieved from their pain or unhappiness. Yeah, that's the best part.
Do you feel like that for every patient?
Most of it, luckily. Yeah.
Do you have any dentist idol in particular? Like who do you like an idol? Like an idol you look up to that was a dentist that you want to follow in his or her footsteps?
That's the person who gave the talk. The professor that gave us the talk during the career talk that I attended after I left my Form 6. That professor is really very smart. From that time, she was already an honest student. Up till now, she's still head of department in one of the local dental universities. So, yeah.
It was a he.
It's a she.
It's a she. Is she still practicing?
She's actually the dean of the IMU, the dental department. Professor To is the name.
if you were given a chance all over again to choose what career you would like to pursue, would you still pursue dentistry? Why?
Yep. You know, when I entered university at the time, there were 17 Chinese who entered UM, and there were only two of us who chose dentistry as our first choice, and one of them is me. The rest all chose. Most of them choose medicine, and dentistry is like their third or fifth choice.
Do you think dentistry has grown over
Good
the
for me. Yep.
Do you think dentistry has grown over the past few years compared to how it was last time? Like,
Sorry, didn't get you.
Do you think dentistry has grown over the past few years compared to how it was last time? Like, is it more like widely recognized now?
Yeah, I believe so. I think nowadays, just in orthodontics itself, most people will want to seek orthodontics treatment, even if their teeth are just a little bit crooked. Whereas in the olden days, people might even consider extracting their teeth and doing a set of dentures with straight teeth instead of getting braces. So people's awareness are much better now on how to treat their teeth, and they're more willing to spend as well.
So that concludes our interview. I'd like to say thank you for making time for me to have this interview. Thank
You're
you.
most welcome.
Thank you.
Thank you.
Okay.
All right,
Bye.
Bye.